wish to begin by acknowledging that this presentation is being held on the lands of the Wurundjeri people, and I wish to acknowledge them as traditional owners. I would also like to pay my respects to their elders, past and present, and Aboriginal elders of other communities who may be here today. This presentation today is focused on the creation of a care plan for an individual experiencing mental ill health. This presentation aims to unpack the mental health interventions and services for this individual. In this presentation, I will include identification of the mental illness, unpacking broader contextual factors, assessment processes, and justification of care through a mental health care plan. By the end of this presentation, you will be able to name contributing factors and burden of disease for depression, identify mental health promotion and intervention for depression, list assessment processes used for depression, and view and critique a mental health care plan. The patient this care plan will focus on is a male who is approximately 45 years of age. I will refer to him as XX. XX was diagnosed with anxiety, depression and PTSD because of childhood complex trauma in 2017. He was exposed to a range of childhood adverse experiences from the ages of 2 to 16 years of age, including witnessing spousal abuse, alcohol misuse by a parent, childhood neglect and low socioeconomic status. XX has a family history of mental ill health, with his mother being diagnosed with bipolar and anxiety and suspicions that his grandfather also experienced these symptoms. He was rehomed into kinship care at 14, however placed back in his mother's care at the age of 15. He inconsistently engages in predominant alcohol substance misuse. What causes depression is unknown, however a range of risk factors can contribute to the likelihood of this mental illness developing. Early experience of trauma, such as complex trauma development due to adverse childhood experiences, can result in insecure attachment styles and inadequate emotional regulation capacities. Individuals are more likely to catastrophize events, blame others, or engage in self-blame, all linked to depressive symptoms and behaviours. Recent studies have found that genetics is a predisposing factor that can play a role in developing depression. This is a growing area of research. Biochemical factors state that brain neurotransmitters focused on mood regulation, including serotonin, noradrenaline, and dopamine, are often reduced or depleted in individuals experiencing depression. Additional risk factors, including long-term illness, experiences of stress, and personality types, particular personality types are more at risk for developing depression, including anxious worrying styles, social avoidance, and rejection sensitivity. The burden of disease varies and includes increased mortality risks and economic costs due to reduced productivity and increased unemployment or absenteeism. A variety of interventions have been implemented across Australia and the world to support and manage the symptoms of individuals who experience depression. These strategies and initiatives range from universal prevention to secondary and tertiary interventions. Universal prevention measures include and are not limited to national plans and policies, including the 5th National Mental Health and Suicide Prevention Plan and Agreement, the National Mental Health Policy, the 2030 Vision stating goals for Australia's support and prevention of mental ill health, and the supporting plan to achieve this vision, the National Mental Health Workforce Strategy. To support children and adolescents, the mental health in primary schools has rolled out across the state, providing professional development for key mental health supporting teachers in all Victorian government schools. Recognition of mental health by raising awareness through national days such as Are You OK Day increase our society's understanding. Secondary interventions include government research and funding, including resources such as Beyond Blue and the Prevention Hub, a collaborative initiative provided by the Black Dog Institute and Everymind. Tertiary interventions include mental health care plans that may incorporate non-pharmacological strategies such as physical exercise, sleep, cognitive behaviour therapy, light therapy and diet modifications, and pharmacological interventions such as medications. These strategies aim to support the mental health recovery of those experiencing depression by ensuring consistency in practice and delivery of supported strategies and interventions to provide adequate, effective care for all, regardless of background, location, and financial circumstance. These tools further enable community engagement, removing stigmas associated with mental health and providing informed support networks for those experiencing depression. Tiered levels of support further provide evidence-based support for those experiencing depression, regardless of where they are currently placed along the continuum. Most importantly, these equip the individual with effective tools to successfully re-engage in their lives. To support the development, implementation and monitoring of this mental health care plan and its impact, I will use a process for diagnosis and care framework, assessment, formulation, intervention and evaluation. Assessment plays a crucial role in identifying the causes and impacts of depression. Furthermore, assessments lay the foundation for a medical care practitioner to develop an effective evidence-based care plan that will meet the client's needs. To ensure that recovery-oriented practice can follow, evidence-based assessments should be utilised. To support XX, a variety of standardised screening tools and informal assessments will be used to provide a holistic understanding of him and his mental state. The MSc interview process will allow XX to discuss his history, observations and concerns, additionally incorporating his strength in conversation skills and providing him with a voice. The Beck Depression Inventory is a self-rating scale that has undergone rigorous research and testing, resulting in accuracy and consistency worldwide. This tool further supports XX in providing voice into his treatment plan through his observations. The EQ5D Quality of Life Assessment will further support the practitioner in determining if any external or internal factors could be contributing to XX's mental state in areas that may need further testing, providing a whole picture of the patient. Finally, the Hamilton Rating Scale is a tool that measures the severity of depression symptoms before, during and after treatment, ensuring it captures baseline data that can be accurately measured throughout the treatment to monitor interventions and their effects. To formulate the intervention, the clinician has observed that XX is presenting issues that directed him to seek mental health support include challenges falling asleep and staying asleep, physical symptoms, emotional changes, and financial challenges. As a result of these behaviours and concerns, he has increasingly begun to disengage socially, developing negative self-thoughts and engaging in alcohol misuse. XX's strengths are identified as being motivated, loyal to family and friends, bike riding, problem solving, open to change, and enjoying conversations. The clinician identified that XX is not at risk for suicidal thoughts, however, he has had friends who have committed suicide. Further consideration for the formulation of this care plan is the implementation of pharmacological and non-pharmacological interventions. XX expressed a desire to not engage in pharmacological interventions, including prescription medication. As a result, these will not be included in his care plan. Positive experiences and results in the past through counselling have identified access to a psychologist will be effective and can be utilised to introduce cognitive behaviour therapy. This will support XX in making changes to his routine, including sleep and thought patterns, enabling him to think more positively and increase his resilient thought patterns when challenged. Additional interventions include introducing regular exercise as a tool to increase endorphins and serotonin, chemicals that support the brain and mood regulation. Working with XX's close support network to educate them about depression has been permitted by the client, furthermore may support him to re-engage socially. The final information to consider in the formulation of this care plan is who encompasses XX support network and their capacity and willingness to provide support for XX. Based on geological locations and regular access, XX's wife and best friend will play a significant role in his support network. Recovery from depression can be achieved with trusted family, friends and colleagues who contribute to an individual's support network. A support network can support through challenging situations, provide different perspectives and help maintain strategies and interventions suggested in a mental health care plan. XX's mental health care plan is the alignment of interventions discussed and agreed on with XX and information collected through the assessment phase. This document highlights his presenting issues, medical and family history, as well as other relevant information that could be contributing to XX's presenting issues. The care plan further highlights the results of the mental health examination, stating that XX is presenting with mild depression due to business struggles. He is at risk of continued alcohol misuse with peers and is having difficulty concentrating or responding to conversations. He is at risk for social isolation. The care plan will support XX's mental recovery through use of strategies that align to XX's passions and strengths, including bike riding and swimming as forms of exercise, and setting of smaller achievable goals aligned to XX's personality traits and motivation and purpose. Providing XX's key support network players with education on depression will enable them to engage successfully and possibly reduce social isolation behaviours he is beginning to demonstrate. Furthermore, education of his wife will ensure the creation of a safe and supportive environment identified as a key component in recovery-orientated practices. Measuring progress is crucial to determine the effect of interventions and strategies implemented and their longevity in supporting the client. The progress of XX's recovery will be determined through comparison data. Assessments were conducted during the assessment phase of this care plan, including the Hamilton Rating Scale for Depression, EQ5D, and Beck Depression Inventory. These will all be completed again on the agreed completion date to measure progress. Ongoing monitoring throughout the intervention, including self-checking questionnaires, will be utilised to assess interventions that may be yielding greater results and modifications that may need to occur to support XX's recovery. Completion of this subject will encourage me to change my practice as I now have a greater understanding of wellbeing and wellbeing models that promote wellbeing. Understanding the mental health continuum will enable me to identify where clients are currently placed and strategies that can be enacted to support their recovery. Identification of risk factors and protective factors will support me in monitoring clients who are at greater risk and utilising protective factors in care plans that promote recovery. The reference list used to support the care plan is on the slide provided. It can also be found in the transcript for this presentation. Thank you for your time today.